All right. All right. So once again, I'm live and I'm back, and um, back, and it seems like everything's starting to. They said I couldn't use updated features and stuff like that, but then I checked it and they said I could. Now I guess I'm good. Um, I don't know. Every time I look around, they always putting up a new video or something. You know, trying to ban somebody or something. What's going on here? Hmm. But anyway, what's going on, brother?
Mic check, mic check.
Yeah, what's going on? How you doing?
What's up with it, man? Salute, salute. Another day, man.
Yeah,
Another
I
day, another crumb.
I sent you. Yeah, I sent you a thing about Dr. Lean. They're living pretty good. Um, as a matter of fact, it was an article that he brought up that I didn't know nothing about it, but I'm glad he brought it up. That the Red Cross, you know who the people who you donate the blood to?
Mm-hmm.
The UN Agency for Palestine Direct Refugees. Controversial former head of the UN Agency for Palestine is the next Director General of the Red Cross. His name is Pierre Cravenbull. So they're going to show you that the people at the head of these agencies got some real demonic objectives.
I had to agree with that.
Yep. So if this is the head of the Red Cross, and they say he was making the ham of the ICRC as it grapples with his own funding, wants it to make cuts in its last 1,500 jobs. So, what's your thoughts on this, man? You think it's a little crazy? A guy from the UN is part of the Red Cross now, and they kind of crazy, man.
Nah, man, we see a look
And
at
this was reported actually by the Times of Israel. Come to think about it, so they say Israel is at war.
is that you breaking up or my phone breaking up?
Huh?
Uh,
Say again.
I don't think I was getting a call. So. Now I don't know. I need to change phones for this. They're getting so many damn notifications, man. I don't know why. Can you hear me?
Mm.
Mic check, mic check. Can you hear me?
Well, let's pull up something
Mic check,
else.
mic check.
I hear you perfectly.
Yeah, man. Peace, peace, peace and blessings to everybody that's listening, man. I don't know, man. We got some technical difficulties, man. See, when we get on these topics, man, we using these devices and some of these apps, man, these websites and pulling up certain articles and certain trigger words and phrases and stuff, man. Seems like we have a lot of technical difficulties going on. Especially we have certain topics to be talking about. You know, they want you to be use discreetness, you know. But this AI stuff is working against us. It's not working for us because think about it. They studying and stealing all our data, and they're forming and so-called AI brain,
There you go. I
computer
got you.
brain.
I got you. I got you. Can you hear me?
Yeah, they kicked you out, or that was what's going on? You
No,
got
no, no,
stuck.
no, no, no. I kicked myself out to see if you could hear me better.
Okay, yeah. Again, because it was breaking up. You was going in and out. So I don't know if it was my end or your end.
Yeah, I know. That's why I took myself out to see if I could fix it. All right. Now back to the clown show. Now, my man Dr. Lean broke down a lot of information in that 2 hour frame. So I don't know if you was listening when he brought up the thing about the tick that they say causing the cattle to bleed out. So that's another interesting thing. Say it's some new kind of tick or something. I say, what kind of tick is this? A superbug?
Well,
But
unfortunately, guess who? That's another one of those talking points in areas of research and studies that the great Dick Gregory brought up back in his day, years ago,
mm-hmm.
8, 9, 10 years ago, with the insects, the fruit flies. I mean, you know what I'm saying? The different insect with the plants and stuff like that, trees and stuff like that. They've been AI in them,
Are we
you
living
know.
a live movie?
A live movie or a green screen set? I don't know. Hollywood? We living in Hollywood? What we living in? Talk to me.
I don't know. I'm about to play a part of the script that's going on right now.
Mm-hmm.
Coming soon to a town near you.
Now I'm gonna bet you that we can probably trace the same script. Probably was been done before in previous uh, life. What they call um, what they call them, turning points
Mm-hmm.
in life. Mm-hmm.
How can I put it? Fair use copyright disclaimer on Section 107 of the Copyright Act 1976 allows me fair use purposes, criticism, comment, news reporting, teaching, what is this? Scholarship, education, research, fair use of use permitted by copyright statute, other matters might be infringing. So guess what? Let's pull this up. If you want some stuff just to get a kick out of. Whoa.
Is warning that flu and COVID combined with holiday gatherings could lead to a spike in illnesses this winter. As CBS's Lilia Luciano reports, a new variant of coronavirus called JN1 may be more contagious but less severe.
COVID-19 cases are rising as a record number of people are traveling this holiday season.
Typically, I will wear a mask. I didn't expect this many people right here, but I did bring one to wear on the plane.
A new fast-spreading COVID variant named JN1 now makes up 44% of all cases nationwide, more than doubling its share from the week before.
The World Health Organization has called this new JN1 variant a variant of interest. What does that mean?
JN1, which we're now seeing, is one that clearly is spreading very quickly around the world. And there's evidence that it is actually causing an increased number of illnesses, and particularly even in some who have already had COVID before or may have been vaccinated before.
This is 23 states are reporting high levels of respiratory illnesses, including COVID-19 and the flu. The CDC sent an urgent alert this month about low vaccination rates. Less than 20% of adults have received the new COVID-19 vaccine and less than 10% of children.
Our concern is that while the overall number of serious illnesses per number of people infected will be lower than we saw previous to the pandemic, if we're seeing widespread transmission, we're going to see deaths go up. We're going to see the number of hospitalized patients going up. And so that to us is really a critical challenge in the days ahead.
A World Health Organization report issued last week said that even though JN1 is better at evading our immune systems, the latest vaccine is still likely to be effective.
The pandemic was so traumatic for people that they just want it to be over and done with. They want to put it in the window and never doubt it again. COVID is going to be with us for the foreseeable future. That does not mean it has to dominate or rule our lives if we take sensible action.
So far, the data shows symptoms for this variant appear to be similar to previous waves. And
Experts tell us the best precautions are to get vaccinated for respiratory illnesses, to test before large family gatherings, and if you are sick, to stay home. Major.
New Mexico is one of the very first states in the U.S. to
Hey, Shaq, where you at, man? Where we at? I don't know, he got something going on with his phone or whatever. Shaq, where you at? I don't know where you at. Okay, don't worry about it. I can fix it. So yeah, so like I said, there's been a lot of things going on. And showing you there's a lot that's going on in here. Trying to come up with a new way to scare you, I guess, like they always do. Nothing new under the sun. That's how it always works, right? Seen the movie before. Stay cautious, be cautious, know what to do. That's all I'm saying. I mean, you don't have to think of me, but daggone, this is very easy knowledge. Just be cautious. Just relax. This ain't no time to panic, man. Like I said, there's no time to panic, so everybody just relax and just chill. We're gonna get through this.
Mexico is one of the very first states in the U.S. to have started drug testing its public schools' wastewater for a range of opioids and stimulants. A Wall Street Journal report looks into some of the data released earlier this month. Out of more than 36 high schools, cocaine was found in nearly 82% of campus communities. And many schools also detected opioids like fentanyl, oxycodone, and codeine. The author of that article, Sarah Randazzo, joins us now. Great to have you here, Sarah. And this is pretty shocking stuff. Talk to us about this wastewater testing technique and how does it work? How common is this?
Yeah, so it's something that has been popular in the U.S., in Europe and Australia for a number of decades. But in the U.S., we really started hearing about it most since the pandemic. It was used to detect upticks in COVID. I don't know if you remember seeing, wastewater showing there could be a surge here. And so it was used for diseases like that. And then now the US is starting to realize, we can do the same wastewater technique to look for drug use. And New Mexico is one of the first places I've found doing this in public schools. And so they literally are testing anything that's flushed down the toilet, to be just frank about it. And so it could be from students, it could be from adults in the building, but over the course of an 8-hour period, they take multiple measures at each campus and then look for a whole range of drugs from it.
Yeah, they're testing for everything. Now, we mentioned cocaine and opioids in the water, but give us a sense of what else the results found.
Yeah, so the cocaine use was surprising, and they're trying to keep in mind that it could be from teachers or staff as well as students. But even so, you don't want to see cocaine in 80% of campuses either way. There was opioids that could have come from legal prescriptions, but also opioids that are often misused. And so it's a little hard sometimes to parse that data as well, but also troubling to see opioids. Fentanyl in particular showed up and I believe it was 9 of the 38 initial campuses. Heroin didn't show up anywhere, which they found encouraging. And then methamphetamines also popped up in most schools and a majority of the schools, but that also could come from ADHD medication as well as things like crystal meth. So, there's a lot to parse in the data, but it's showing a high presence of drugs in a lot of these public high school campuses.
Yeah, really high, and obviously very unsettling. So how will these results help schools deal with this situation?
Yeah, so I spoke with some school leaders. Most of these initial schools were around Albuquerque. So I spoke with the leader of the Albuquerque Public Schools, and he said, yes, we know we have a drug problem. We catch kids with drugs in the bathroom. We've seen it in surveys. This is kind of another data point we can use. State public health officials are saying this should be a wake-up call. This should initiate more conversations. So essentially, there's two things they can do. They can beef up education programs of trying to drug prevent, and they can also use it, hopefully, at the state level to create better treatment facilities. Some of the school leaders said, we're a school. We can say, here's how we can help and educate you. But if someone needs treatment for drug addiction, they have to send them elsewhere. And so they're hoping this data could be used to create better treatment facilities that the schools can direct kids toward.
And you got to realize people around the country are watching this, right? And they're wondering, is this testing specific just to New Mexico, or are other states doing it as well?
Yeah, so I've seen it in other states, including California, Delaware, Virginia, and some others in local municipalities. There'll be a countywide effort or a citywide effort, or maybe in some statewide efforts, but never in the schools in this way. But I have a feeling New Mexico isn't going to be the only state to decide this is a good idea for public schools, but there are communities around the country doing this more broadly, and there's even some federal money, some grants that are being given in the last few years to do this on a municipal-wide level.
Yeah, I can't imagine more schools won't want to do that. All right, Sarah Rendazzo, thanks for that. Really appreciate it.
Yeah, sure thing.
And then I switched to Liberty Mutual and saved hundreds. I know, exactly.
That flu and COVID combined.
I want to go down as the best school shooter in history.
After pandemic-era protections expired. NBC's Zinkley Asamoah takes a look at what's happening in Texas, where more people have lost coverage there than anywhere else in the country.
We've been seeing a lot of patients that...
Yo.
What's up? Hello?
Yeah. What's up? God, I'm waiting.
I have no idea that their Medicaid ended.
Across the country, millions of Medicaid subscribers are at risk of losing health insurance.
And when one doesn't have access to insurance, those decisions are being made based on, am I really as sick as I think I am? Do I really need to go?
In Austin, Texas, Community Care Health Centers, a network offering free and low-cost care, is scrambling, not just to re-enroll, but also to educate the community on how to keep their coverage.
We have been constantly busy all the time.
For 3 years during the pandemic, Congress required Medicaid programs to keep people enrolled.
It meant that our patients and their families had access to sustained benefits and had access to continuity in their Medicaid benefits. That is life-changing, life-altering.
Now, that continuous enrollment is over.
We've never had 90-some million people enrolled in the program, and we've never tried to do this all at once. So every state across the country is going through this process as we speak.
So far, over 11 million people have lost Medicaid coverage nationwide, according to the Kaiser Foundation's analysis of federal data. In the states that have data available, about 71% of people are losing coverage, not because they're ineligible, rather for procedural reasons, like missing paperwork. The sudden volume now putting a strain on states.
Just about a quarter of all the children losing Medicaid are in Texas. This is huge. We've never seen a decline like this.
The HSSC telling NBC News that as of December, it is taking an average of 60 days to complete an application for Medicaid. But Texas lawmakers want more. Over the summer, Congressman Lloyd Doggett and a dozen of his Democrat colleagues urged the Biden administration to take action and have since continued to push the agency to ensure the enrollment process is timely.
And without federal intervention, more and more Texans, pregnant women, children, individuals with disability will be denied health care when they should not be.
The Biden administration telling NBC News that they were working with Texas to fix the problem.
We have met with the state, we have reviewed, and we did require Texas to reinstate over 90,000 people that were incorrectly disenrolled from the program.
This fall, HHS announced that 500,000 children regained coverage after working with states on reported systems issues. In the interim, as state agencies wrap up this year's Medicaid eligibility checks, community healthcare clinics like Dr. Forner's are stepping up.
For someone who has a chronic disease or a disability, a lapse in coverage can actually cause their existing medical condition to worsen significantly.
Zincle Asamoah, NBC News.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.
That's very concerning when you really think about it. But they go to show you that while you had your head down, they've been doing a lot of moves behind the scenes. So always gotta look up. Don't look down. More behind the scenes than you know. And we just have to be prepared for what's coming. Consequences will not be nice. It won't be pretty for everyone involved. So that's the unfortunate part of it now. Let's see.
Thousands of migrants have joined a caravan in Central America that's making its way to the U.S. It comes as Secretary of State Antony Blinken prepares to visit Mexico's capital tomorrow. Morgan Chet back here at home to our...
What's going on, brother? You back? Yo. Chak. Yo. I don't hear him. I'll just keep on going with the picture.
south, where thousands of migrants have joined a caravan in Central America that's making its way to the U.S. It comes as Secretary of State Antony Blinken prepares to visit Mexico's capital tomorrow. Morgan Chesky reports from the border.
Tonight in southern Mexico, a new migrant caravan is heading north. A group of men, women, and children, whose organizers say is now 8,000 strong, after an estimated 2,000 more joined in a single day. The caravan last seen in the Mexican state of Chiapas near Guatemala would be the largest since last year. Many of them desperate and exhausted. This father from Honduras sharing his 3-year-old daughter is now too weak to walk. The U.S. border's still more than 1,000 miles away. In Eagle Pass, Texas, just days after these stunning scenes of migrant families lining the Rio Grande, tonight U.S. Customs and Border Protection facing a quiet lull that likely won't last long. Outside an Eagle Pass shelter, we met Osmani, Marian, and Edison. Don't van ahora. Where are you going now?
Oklahoma.
Oklahoma?
Los Angeles.
L.A.?
Dallas.
Dallas. Marian from Venezuela says she's now waiting. I'm hearing. After a 5-month journey here, she called dangerous but worth it. Mexico's president now saying he'll meet with U.S. Secretary of State Antony Blinken tomorrow in Mexico City to discuss potential joint solutions. Texas Governor Greg Abbott taking his own steps, installing more barbed wire on the border and busing more migrants to primarily Hispanic-led cities such as Chicago and New York, both now buckling under rising numbers.
Governor Abbott has made it clear he wants to destabilize cities and sending thousands of migrants and asylum seekers.
Tonight, as that migrant caravan makes its way north, lawmakers in Washington still need to strike a deal over southern border policy, but as of right now, there is no clear agreement.
Thanks for watching.
Hey, Dawson, what's going on? Yeah, they have some technical issues with Chak, but covered a few topics about the Medicaid, people losing Medicaid protections. Of course, they got a new virus. They say it's, spreading around the holidays, and they say they found cocaine in the wastewater up there in New Mexico, one of them. So they said they drug testing the wastewater. So go figure all that out. More clown shows. Unfortunately. Let's see here.
When there's nothing.
So while all that was going on, they were talking about hate on campuses and all that stuff. I seen the article. Matter of fact, I might. Well, let me go back and I had to go back and play that. It won't number 3 minutes long. I want to cover this. I'll find the article. Matter of fact, since I'm thinking about it, I know what I do. Yeah. I just put it in group just make it easy. All right, so that's fine. Let's find this out.
Thing holding you back. What would your thing be?
So the number one topic of the day was always been the clown show. Mr. Greenblatt is back. He was on X again. He's talking again. He's back.
Do you watch Sparkbox? Do you ever get a chance?
Now and then.
Do you watch Desenhall, Eric, yesterday saying that the only racism that's suddenly somehow okay is anti-Semitism among these college kids? And I keep making the point again and again.
Yeah.
The lowest common denominator on safe spaces and microaggression, they somehow are able to be totally outraged by the most ridiculous things, and yet they're the same ones that are now saying genocide to the Jews.
Yeah.
How do you explain that?
Look, you got it right when you were talking to Walter a few minutes ago. It's a bizarro upside down world when you can be canceled for misgendering someone, but somehow you get celebrated for describing your Jewish classmates.
You can get fired as a college professor for misgendering.
And yet we had professors who were out there celebrating.
I have given you a lot of grief about throwing your lot in with the woke left too.
I would.
Here in the past, and I've been right all along. But here's what Holman Jenkins. I think we have this for you to read, and you can respond to it because he's right. Somehow Elon, when it was all said and done, Elon, they took this tweet and turned it. But here's what he says: the 37 words of interpolation for a 6-word tweet.
Yeah.
He heatedly denied it. The journal examined the content and said what Mr. Musk was really exercised about was you, the ADL, because he thinks you've largely adopted the identitarian and censorship agendas of the progressive left. And I've given you grief about that. So you throw your lot in with them and look what they give you.
Look, if pushing back on white nationalism and the great replacement theory is somehow identitarian politics, I don't know what to tell you.
Do you think those 100 morons in Charlottesville are the problem, or do you think the college professors that have totally brainwashed our children on the left with anti-Semitism? Where's the real problem?
Look, let's acknowledge that, like,
You back in action, man?
Yeah, man.
All right, good. Because look, I done went through a couple things. They went over pandemic protection ending for Medicaid. I went over, they found they've been drug testing the wastewater for cocaine in New Mexico, or was it Mexico? I think it was New Mexico. They say the water got cocaine in it.
The water in Mexico got cocaine in it.
Or was it New Mexico? I had to go back. New Mexico? It's either Mexico or New Mexico. I gotta go back to it.
All right, I'm gonna mute up.
But look, wait. Because daggone, I went through all that. I said, I don't know when he getting back on. So I said, I gotta get all the thing. And they talking about all this stuff going on college campuses and what they need to do and things like that. But you know what's so funny today? I saw an article today where they actually talking about in some places they're gonna start reducing some of these degrees, and you don't have to get a bachelor's degree in a lot of these places no more to get employment as a prerequisite. So that's kind of interesting. So why they talking about this stuff anyway? All this stuff going on college campus, they gonna get rid of some of the prerequisites anyway. So it's very interesting. But that's either here or there. I'm just letting you know. Now, let's get to the censorship guys, because they've been censoring me, they've been censoring you. But I like this actually video because the guy did ask Mr. Greenblatt about his identity politics. He did ask, but you'd be surprised to hear what he says. So just listen. If you hear anything, just jump in.
Somehow okay is anti-Semitism among these college kids, and I keep making the point again and again.
Yeah.
The lowest common denominator on safe spaces and microaggression, they somehow are able to be totally outraged by the most ridiculous things, and yet they're the same ones that are now saying genocide to the Jews.
Yeah.
How do you explain that?
Look, you got it right when you were talking to Walter a few minutes ago. It's a bizarro upside down world when you can be canceled for misgendering someone, but somehow you get celebrated for describing your Jewish class.
You can get fired as a college professor for misgendering.
And yet we had professors who were out there celebrating.
I have given you a lot of
death of
grief
civilians.
about throwing your lot in with the woke left too.
I would.
Here's here in the past, and I've been right all, but here's what Holman Jenkins. I think we have this for you to read, and you can respond to it because he's right. Somehow Elon, when it was all said and done, Elon, they took this tweet and turned it. But here's what he says: the 37 words of interpolation for a 6-word tweet.
Yeah.
He heatedly denied it. The Journal examined the content and said what Mr. Musk was really exercised about was you, the ADL, because he thinks you've largely adopted the identitarian and censorship agendas of the progressive left. And I've given you grief about that. So you throw your lot in with them and look what they give you.
Look, if pushing back on white nationalism and the great replacement theory is somehow identitarian politics, I don't know what to tell you.
Do you think those 100 morons in Charlottesville are the problem, or do you think the college professors that have totally brainwashed our children on the left with anti-Semitism? Where's the real problem?
Look, let's acknowledge that like shooting Jews praying in a synagogue in Pittsburgh is a problem.
I do not.
Death threats against a Cornell student are a problem, right? We can have problems from the extreme right, the white nationalists, and problems from the hard left and the crazy anti-Zionists. Like these are both problems, but right now, let's be clear.
Like there's
we are
1,000 to 1. There's 1,000. They're crowded. These
there
colleges.
is no look. We have tracked almost 1,500 anti-Semitic incidents in the 50 days since the massacre. That's a 300% increase over the prior year, which was at the time the highest number we'd ever seen.
How does October 7th engender that exactly?
Yeah, I mean, it's blaming the Jews.
What's that?
This collective blame. It's a despicable form of hate. And trying to legitimize anti-Zionism is contemptible.
It's hate when you put the blame on somebody. It's okay for them to say Hebrews, but blacks this, blacks did that,
place, and that Columbus,
Nazis did this, Aryans did this, Asians did this. And when it comes to Jews, they don't want no blame.
Joe, I will tell you, the image of these protesters tearing down American flags last week, at Grand Central Station. The image of these people yesterday trying to violate Rosalind Carter's memorial center.
Do they think that Hamas would treat them well, some of these marginalized groups?
Ayaan Hirsi Ali got it right. Queers for Palestine.
That's what I mean.
Is just idiotic when Hamas literally lynches LGBTQ people. So it's like you said, it's a bizarro world. But now the question becomes, what are we going to do?
What are we going to do about it?
And so look, at ADL, we are pushing back on this hate on the college campuses. We launched with Gibson, Dunn, and Crutcher and a group called the Brandeis Center, a legal helpline.
I say, but no, we sit back and let them fight it out.
6 violation.
That's what we say. I say we sit back and let them fight it out.
Hey, look. Huh? You got a point there. I just let you know, but I also got to let you know. Don't let your child, anybody listening to this chat, go to college and have to deal with this nonsense.
Look, I say let them fight it out. You know what I'm saying? Don't nobody, if this ain't your fight, let them fight it out. No, I see. And you see the LGBT against the LGBT against the
Hey, I like it. I like it. Hey, I ain't mad at him. But that's why I played it so you can hear it. Because he said that they going against, they got a group called Queers for Palestine. He telling you that Hamas lynching LGBTQ people or something like that, right?
But what does that have to do with them being Palestine and for Palestine? Hamas is not the whole Palestine. See the trick they try to play. See, that's what I'm saying. He's a dirty dog trying to play a dirty trick. Everybody in Palestine ain't for Hamas. Just like everybody ain't for certain. We Americans, we respect American values, but it's things that we are pro and things we are anti in America.
Yeah,
right. We are anti-tax, but we are subjected upon it until we can figure out how to separate ourselves from this overtaxation, taxation without representation.
Well,
come on, dude.
Look, he say, hey, look. According to his logic, he calling you homophobic.
No, he is calling the Hamas. Yeah, he calling them homophobic, right?
Yeah.
Right? But he ain't talking about. You mean tell me Israel, the Israeli, they ain't got no homophobic people that's there.
Come on, man.
You ain't got not one Jewish person, a Zionist person that's homophobic. Ain't that what they was doing to the people over there in Nazi Germany? Come on, man. See, these niggas full of shiznizzle. But see,
Yeah.
it's a cry. He keeps saying they don't want to play the what they say, the Trauma Olympics, but that's all they playing. That's the angle they play.
Oh, come on, man. You know they playing that. You know that.
Come on,
hey, that's what they doing, man.
Every time they see somebody else is being superly oppressed publicly in the media, and some people crying out and saying, "Hey, man, these people oppressing us, man. We're gonna have to do some uprise." Here they come,
Hey, Chak, what's
interjecting
the term the
themselves.
women? What's the term the women used to say back in the day? Your dad used to tell you back in the day. Ain't no romance without finance. And there
It's a
go.
nuisance.
You can't. Yeah, but guess what? And they saying, and what they saying is, somebody got to be played. Somebody playing the game, and somebody got to be played. That's what Green Bay telling you. He said, we're gonna play the hell out y'all. That's what he told you.
But I tell these American Negroes, sit back and let these motherfuckers fight it out. And then we had to take on the motherfuckers, the winner. But you know, we always want to go to other people rescue when we limping. We handicapped and shit. We trying to rescue niggas and we got a handicap.
I mean, handicap yet. Yeah, right? Shit. There you go. We got 2 crutches and 5 games. Shit.
No, we handicapped because motherfuckers still in La La Land. Motherfuckers still think they're Hebrew. Motherfuckers still think
Chak, man.
Hey, that's
come
a
on,
handicap.
man. It's a holiday season, man. There go shoot, man. There go everybody wishing for a star and stuff right now. You know what I'm saying? Shit.
Yeah.
Nah, I'm joking. Hey, look, man. All I got to say, baby, get them decorations down. Cause after the rules is over, it's time to get back to work. God damn it. Because this thing in 2024 could be a real thing. I mean,
right.
Hey, look, you heard what Dr. Lean said earlier. They about to say the money is a super spreader.
They about to do what now?
They gonna say, "Oh, we can't use paper money. It's dirty."
Right, it's dirty. And they the ones in
Digital
dirty
currency, baby. Hey, look, man.
Yeah.
There you go. I guess it really is paper.
We got Dawson in the chat. Who all we got in the chat? Let me look and see.
Yeah, Dawson in the chat.
Salute. Peace to all the people in the chat, man. Salute to all the people that's participating. Dawson, anybody else?
Saw that thing with the people. Yeah, man, it's interesting though. But like I said, the clowns are back, and they'll be back after Christmas. After the Christmas holiday and New Year's and all that. You know what? While they let the ball drop, they still bombing people. It's kind of crazy how you let the ball drop. This thing got wild, man. You really think about it.
Why they let the bomb drop while they bombing people? Ain't that's what they was doing allegedly with this with the Titanic? Oh, the band was still playing. Everybody was drinking and popping champagne as the ship is sinking. Wow.
Yeah.
Wow.
Hey, look, man. The ship is sinking. Now let me get back to something right quick because I want to make sure I was right on it. I know I'm right because I played it earlier. Wait a minute. Maybe I can't find it right. Oh yeah, here it is. Widespread cocaine usage found after
widespread cocaine usage. That's what health officials in New Mexico say they found in testing wastewater for opioids and stimulants at dozens of schools in and around Albuquerque. The discovery came during statewide wastewater testing at high schools ordered by Governor Grisham after she declared drug abuse a public health emergency. As results begin to pour in, state officials and parents are getting a closer look into what may be being passed around classrooms. And it's not just notes. Officials had expected to find fentanyl and other opioids, but they were surprised when they tested nearly 40 high schools and found cocaine use at more than 80% of them.
That there's widespread cocaine usage in these communities. And I think that was a big surprise for all of us. In addition to that, we saw that there was fentanyl in some of the schools as well.
According to newly released data from the state, of samples collected from 38 schools, 31 of them tested positive for cocaine and its metabolite. Fentanyl and its metabolite was found in nearly a quarter of the 38 schools. The state also tested for heroin, but found no trace in any of the samples. Officials do warn to compare results with caution as the data has limitations. For instance, the data cannot tell who is using the drugs as the samples include everyone who used the bathroom on the day it was taken, such as teachers, staff, students, and visitors. Officials added that it is not possible to determine whether or not all the drugs detected are legal or illegal. Still, Governor Grisham says the first its kind initiative gives data that can act as a jumping point for schools and policymakers to make informed decisions to combat substance abuse in their communities. Quote, knowledge is power, and having more data about the presence of illicit substances in schools informs our collaborative efforts at the school, community, and government levels, end quote. As of last week, the state announced nearly 90 schools have been tested statewide, and testing will continue with data being released weekly.
Man, Chak, that's a real doozy, ain't it, Chak? Ain't that a real doozy right there? Huh? Hey, are we at war? Chak.
Oh. Yeah, hold on, brother. I hear you. Hold on.
All right, cool. Well, that is a very pressing topic. How you doing, Steve? I'll holler Mac. That is very true. That is very concerning when you got stuff in the wastewater like that. I'm pretty sure. But you got to remember that governor out there in New Mexico is also the same one that was the one that was trying to suspend the Second Amendment too for 30 days. So you got to remember that as well. So don't forget that. That's a very interesting topic.
In the middle of the night,
So we got another thing I'm going through right quick, and this is hospitals are closing in the U.S. Now, earlier tonight, I think the brother Dr. Lean broke down about the hospitals and that Israel is trying to get control of some of these hospitals or got them from cyber security or something like that. So that's interesting. But a lot of hospitals are closing, which, I mean, in a way, that means it's gonna be a mass population reduction. But two, sometimes I think that they're gonna really need some of them anyway. Some of the doctors ain't no damn good no way. Just saying. You know, it is what it is. Oh, yep, I'll send you that. Why hospital closed at an alarming rate. I will send you that. That is no problem. Let me let this thing play though. Yeah, well, I might add it because actually it'd be better just let hear what they're saying as well.
Byron Stripling found himself driving 110 miles per hour in search of critical medical care for his pregnant wife, Harmony. She was in the passenger seat and was due in 4 days.
Between 12:30 and 1 a.m.,
She came in the room and was complaining about having chest pains.
The couple lived in Belzoni, Mississippi, a city whose only hospital had closed 8 years earlier. The closest hospital was 30 minutes away, and Harmony needed medical attention immediately.
She was, having seizures or heart attack. I was driving. I had my AirPods in, and I called 911, and they were telling me that she needed immediate oxygen. So they needed me to pull over right then and start CPR.
And that's exactly what Byron did, on the side of the road, in the dark, 2 minutes from the Yazoo City Hospital. The ambulance took another 15 minutes to get to the scene, but it was too late.
If my wife had oxygen sooner, it's a possibility that my daughter would have survived. And who's to say it's a possibility that she would have survived?
Tragedies like Byron's play out all across rural America, where a total of 195 hospitals have closed since 2005, and 600 more are on the line. These hospitals aren't closing because rural Americans require less care. No, that would make too much sense. What's actually playing out in plain sight is maddening. Health insurance companies and politicians playing partisan games have conspired to create a crisis with life-threatening implications. Byron's home state of Mississippi is the poster child for this. Nearly 50% of the state's rural hospitals are currently in danger of closing. So we went to the Magnolia State to investigate what happened, who exactly is responsible, and how simple solutions with nearly zero cost could stop these lethal closures, potentially saving lives like Harmony's.
Where we're sitting at today is in the closed wing of the hospital. We have two, a west and an east wing, 25-bed inpatient unit. And so on this side, we closed it down a little bit less than a year ago.
Lee McCall is the CEO of Neshoba County General Hospital in Philadelphia, Mississippi, one of the 34 hospitals at risk of closing. Rural hospitals like Lee McCall's face three main obstacles to staying afloat: private health insurance companies not paying enough, Medicare not paying enough, and partisan politics keeping far too many Americans uninsured. I'm going to take you through all three of these, one by one. To start, let's talk about the first obstacle for rural hospitals: private insurance companies.
There is one big difference that we've seen in terms of the hospitals that have closed and are at risk of closing and those that have not closed and are not at risk, and that is how much they're being paid by private insurance plans.
That's Harold Miller, the author of this report on rural hospital closures.
The tradition in America for many years has been that healthcare providers and insurance plans negotiate to determine what's the right amount to pay. And the challenge is that bigger hospitals are in a much better position to negotiate with a big insurance plan than a small hospital is. So in many cases, the insurance plan says, here's what we're going to pay you. We're not negotiating. And so rural hospitals are increasingly now facing greater losses because their costs have been increasing, and the payments to be able to address those costs have not been increasing proportionately.
Harold advocates for changing the structure of how insurance plans pay hospitals, particularly small rural hospitals like Neshoba General.
But rather than simply paying them whenever they deliver a service, it would actually make sense to pay them for both of those services that they deliver. A standby capacity payment that gives them enough payment to be able to cover the minimum costs of being on standby for emergencies and other essential services.
States have the power to intervene and moderate hospital prices. One state in particular has done a great job addressing this. In Maryland, the state government regulates the fees that hospitals charge for services and requires all insurers to pay those fees in full. This means private insurers are barred from underpaying rural hospitals. As a result, Maryland has fewer rural hospital closures than any other state in the U.S. The second obstacle for rural hospitals is Medicare. Medicare has long been one of the best payers for rural hospitals, but that changed under Ronald Reagan.
In the 1980s, when the federal government changed how Medicare was going to reimburse all hospitals, it had a much greater impact negatively on rural hospitals than I think that they anticipated.
Chad Netterville is the executive director for the Rural Hospital Alliance in Mississippi, a network of 41 rural hospitals collaborating to survive in this catastrophic environment. Chad explained that instead of reimbursing hospitals the full cost of delivering a health service, Medicare began to pay a fixed fee for each service. But they base that fixed fee on data from big city hospitals, neglecting the fact that small rural hospitals tended to require more money to deliver the same services. This is because there are fewer patients, and therefore fewer payments to sustain basic hospital services. Over 400 rural hospitals closed in the 80s and 90s because of this change in Medicare funding. The government's response to these closures was to create a special category of Medicare funding for rural hospitals in 1997.
They were doing things to create an opportunity for these rural hospitals to stay open and survive, because they did not and couldn't afford, nor did the larger hospitals want all these rural hospitals to close.
But in the decades since that change, budget cuts have eroded that funding, as has the fact that more and more patients are moving to Medicare Advantage plans, which puts private insurers driven by profit motives in charge of paying hospitals. In an effort to address this issue, Congress has introduced the Save Rural Hospitals Act, which would establish a fairer Medicare reimbursement rate for care. If passed, it could bring desperately needed federal money to rural hospitals and help avert closures. The third culprit behind rural hospital closures is more political and petty. In 2010, Democrats expanded Medicaid to cover hundreds of thousands of uninsured Americans. But Republicans in many states, including Mississippi, refused to expand the program. Not because it would cost the state anything, just out of pure political spite.
Here in Mississippi, your leaders stood strong and stopped the expansion of Obamacare.
And that brings us to our third obstacle, Republicans' refusal to expand Medicaid, a decision that has unnecessarily left 230,000 Mississippians uninsured. Unsurprisingly, states that did not expand Medicaid or only chose to do so during the pandemic account for nearly 75% of rural hospital closures in the last 10 years.
About 10% of what we do is uninsured, uncompensated care. When a patient walks through the door, we take care of them, irregardless of their ability to pay, and we worry about that part later. The actual cost attributed to uncompensated care is around $5 million. So annually out the gate, we're in the whole $5 million that we're trying to make up.
Expanding Medicaid would provide $1 billion to the state from federal coffers to help cover the cost of health care.
It would help our hospital by offsetting the uncompensated care costs. It would help those individuals who are uninsured or underinsured be able to access health care and have it paid for without jeopardizing their livelihood or ability to put food on the table or pay their bills.
Despite widespread support from healthcare groups and the majority of Mississippians, expanding Medicaid has remained politically contentious. So much so that it has become the defining issue of this year's governor's race between incumbent Tate Reeves and Democratic challenger Brandon Presley.
Right now, there are 38 more rural hospitals just like the one I'm standing in, and they're on the brink of shutting their doors. If hospitals continue to close, the impact will be catastrophic.
But it looks like the tides may actually be shifting. Though Governor Tate Reeves remains opposed to Medicaid expansion, the incoming Speaker of the State House, a Republican, has suddenly put Medicaid expansion on the table.
I will admit and say, there's a reckoning coming for healthcare, not just in Mississippi, but nationwide.
Disasters like Byron's are avoidable. State legislators need to expand Medicaid. Congress needs to pass the Save Rural Hospitals Act. And states need to step up and regulate private insurance companies. For people all across rural America, this is a matter of life and death. Thanks for watching. And as always, don't forget to like and subscribe to see more videos like this one.
Widespread cocaine usage. That's what health officials in
Chak, you still there? Chak.
Yeah, I'm here.
What do you think about that, man?
About this Will Herb shit, man.
Yeah, you said about all these hospitals closing.
Well, you know why they close them, right?
in the name of private equity and hedge fund management too.
But there you go. You got Walmart that's coming into being a medical providers. Amazon being a medical, pretty much healthcare. Get into the healthcare. All these places, like you said, these private NGOs and stuff becoming. They subsidizing motherfucker. Excuse my language. We know what's going on. They subsidizing major things like healthcare, medical care, like medical facilities, medical, pharmaceutical, insurance. They even are doing it with the grocery stores. I mean, we're seeing the same thing. They are monopolizing. You have, and I don't know who they is. I guess the ones that's been collecting money behind the scenes. They're putting together, like I say, these big NGO groups that's doing these buyouts. They buying out. They deliberately, and I think that's another reason why they was allowing people to go in and ramshack these stores, and they pretty much decriminalized shoplifting, stealing, and theft. Huh? To deliberately tank the economy. So now they can come back as saviors. Problem, reaction, solution. We know the game. It's the same script. You create the problem, right?
Kind of like Pfizer. You know, they
react.
Like
you
Pfizer, they give you something. Like Pfizer, they give you something. Now they got a cancer thing. I'm gonna do a part 2 on some of this stuff too, like this Ozempic medication. They say one is a side effect. They claim give you cancer. I say, wait a minute now, hold on. Why you making something for cancer then? See what I'm saying? They got you coming and going again.
You know what I'm saying?
So anyway, I'm looking at
all these things.
I really don't care. I really don't care about the weight loss thing because I've been doing personal training for 2, 3, 4 years now. Just go to the gym. Forget all this Ozempic. Forget all this nonsense. Okay? Go to the gym, eat right, get the thing. All this weight loss, Weight Watch, all that stuff with the lap band, gastric bypass, that ain't nothing but a bunch of bullshit. Okay? When you can take your own steps to be healthy. You don't, or get in shape. You don't have to, because this stuff is daggone just completely ludicrous that you got people promoting this stuff at this big of a level. Like I said, when I was young, I had my grandma, my aunt, and I saw a few people. I did not see that many. I went to school. I had a Jamaican guy I went to private school with, one or two. I think it was a girl named Ashley. She might have been a little overweight. But for the most part, I did not see overweight children, and I did not see overweight people that often. When I was born in 1987 to probably about 1990. Now you almost see that 1 to 3 people walking down the street, probably 4, actually, maybe more than that, actually. But I'm just saying, so all this stuff, these medications, or what they call it, Ozempic, which is an injectable, it's a bunch of bull crap, man. We got to call it out. So, like I said, I got to get early again, but I got about 10 minutes left. Anybody want to call in? 571-450-0773. Probably about 10, 15 more minutes. It's very interesting that at a time, and I actually tell you true, Shaq, I mean, they were talking about, all these people traveling when you was off or whatever was going on. I played you the video. I played a video of they saying that this new JN1 or whatever the hell it is now, is spreading, and 18% of people then got their little candy spray or whatever you call it, as Frank calls it. So it is what it is. And they're saying that the steps to take or whatever. But they also said that there's more people spreading around the holidays. Now, how about this? The urgent care center down the street and stuff is packed, okay? You know how people go to dag on the urgent patient first and all these little urgent care up the Med Express up the street and go there the next day because they ate too much on Christmas Day or whatever they did?
Of course. That's how the game goes.
Okay. So that's how sickness spread, man. You don't eat too daggone much, man.
Well, that's what they've been doing over here, man. They're putting chemicals in. I can't even call it food, man. I'm just calling it products. The products that we purchase and buy every day. They're putting additives and chemicals in there that making you want to overeat, gluttony, and you ain't really getting full. You're not getting no nutrients. You're not getting fulfilled, no fullness for a short time. That's causing people to overeat, excessively eat. You know what I'm saying? Binge eating and stuff. You know what I'm saying? And because you could just think about all certain. How many recalls we done had? They recalling all these
Hey, they recalled some sodas, but like I told the guy, I don't care. Shit, you call them, motherfucker. We don't need them anyway. We don't need carbonated water. Now look. Now check this out. This is something I ain't know. Well, I kind of knew it, but I didn't know they made an article of it. It said the U.S. has registered the highest number of mass shootings in 2006.
These are all jobs for someone with autism.
Turn to that scary story out of Florida, where Spirit Airlines mistakenly put an unaccompanied child on the wrong flight during the holiday season travel rush. Spirit has apologized, but did not provide any explanation for how that 6-year-old child ended up in the wrong city, nearly 200 miles from his intended destination. NBC News correspondent Sam Brock has the details.
Spirit Airlines this morning is apologizing after a 6-year-old boy was placed on the wrong plane. The child, flying alone for the first time, boarded a Spirit Airlines flight in Philadelphia. He was supposed to fly to Fort Myers, Florida, but instead took a nearly 3-hour flight to Orlando. His grandmother, Maria Ramos, waiting for him at the Fort Myers airport.
I was so excited about seeing my grandson again.
Ramos told CBS affiliate Wink TV that realizing her grandson wasn't on the correct plane was one of the scariest moments of her life.
My stomach was tight, my heart was pounding.
The flight attendants in Fort Myers telling Ramos her grandson missed his flight, but that Ramos had his check-in tag. Once Spirit Airlines tracked down the correct location of her grandson, Ramos raced to the Orlando airport, a 4-hour drive away. In a statement, Spirit Airlines saying, the child was always under the care and supervision of a Spirit team member, and as soon as we discovered the error, we took immediate steps to communicate with the family and reconnect them. We take the safety and responsibility of transporting all of our guests seriously and are conducting an internal investigation. We apologize to the family for this experience. Unaccompanied minors have gotten on the wrong plane before, like in 2019, when 14-year-old Anton Berg flew to Germany instead of Sweden. This whole ordeal reminiscent of a blockbuster holiday movie.
Oh no, my family's in Florida and I'm in New York.
A happy ending for the Ramos family, despite the questions that remain.
How did that happen? Did they get him out the plane?
Now that's a travesty right there, man. That's a bad stuff right there, man. But yeah, wow. Never a dull moment in this life, huh? What do you think about this, Shaq? Unaccompanied minor goes to the wrong area. Do you know where your kids are? as they say. You hear me, Shay? Shay. Yeah, that's a very troubling story. I mean, of course, it had
Yeah,
to
I'm
be
here.
spirit. What do you think about that, man? A child going to the wrong state.
I mean, you probably don't. It's probably more common than more
Yeah, I
common
know.
than that. Just like you losing bags, just like they lose bags and stuff. It's a human error. First of all, how old was the child?
6.
And it was on a flight by itself.
That's what I was trying to tell you, man. I ain't understand that. I wouldn't have put no child 6 years old on the flight by themselves.
But they do that, and they have I forgot what they call them, but they pretty much be shop. I forgot the actual name, but they pay more with the ride with them. It's supposed to be like pretty much like chaperones or you know.
I know my nephew one time flew to Chicago by himself, but go meet his.
But I don't know if I can do that. I don't know if I don't know if I got enough strong enough to tell a 6-year-old yo. I don't know.
But
I guess.
I mean, I remember I got my bags. I mean, I went to Houston. I mean, I did daggone. I landed in Miami, and I remember my bags getting put on the wrong flight. No. They didn't get put on the wrong flight. They sent They sent me on the flight without my bags and put my bags on another and I had to come back to the airport to get my bag. I didn't understand that one. That was a real doozy, man.
Wow.
But I remember that. So I mean, shit happens, man. But it's one of those things, man.
What I told you about the homeless lady that was allegedly supposed to had gave birth to a baby on the streets, and the guy he witnessed it. He heard somebody hollering. A woman, something like a female, was screaming outside his window or whatever, and he was looking outside early in the a.m. I guess yesterday morning, and he saw her having birth right on the sidewalk, and she ended up taking the baby and putting the baby in the damn trash can and walked off. That's something traumatic, man. I don't know how, I would have kicked in action. I'm like, damn, to see something like that gotta be traumatizing, man. Damn.
But that shows you how crazy this life is. But and speaking of that, in Belgium, they talking about euthanizing. This ain't got nothing to do with the child, but they talking about euthanizing children with autism or some shit like that. Boy.
Wow.
And Dr. Lena brought it up. Well, the court had dismissed the case of children being euthanized autism with some doctors. They taking this thing to a whole new level, baby.
So why did the child, what is the reason for autism?
Well, kind of like he said. I like what he said tonight. He said you could be diagnosed with autism. He said dag on the spectrum. He said he said half the population they claim they got ADHD or something like that. So he said they could diagnose you with it. He said there ain't never been no clear diagnosis for this. You know what I'm saying? Because they grade you on a spectrum. I mean, just kind of think about it.
And what is the ADHD? What is the actual acronym for ADHD?
Attention deficit hyperactivity disorder.
Hyperactivity, attention disorder. Man.
Well, look, I'm gonna ask you a question, Shaq. How many children do pay attention? Children. You look. Let me tell you something. Children always moving around. Child ain't sitting still that long. I'm sorry.
That's correct.
They're going. I mean, let's just use your boy Paul. You know, sometimes you want him to be on the show, but sometimes Paul can't speak that long because he got a little 3-year-old or 2-year-old, whatever, walking around. She ain't gonna sit there and allow you to sit on no damn show or nothing like that.
Right.
I mean, best thing you do when you sleep with children, they gonna get up and move. And they right there, that's what they do.
Now you gotta, yeah. That's what I
Children
said,
will
man.
move till they sleep, man. They
I
gonna
think we
move
need
till
an
they
overhaul. I
The
think
only
it's a
time,
couple things we need to
actually, tell
overhaul.
you, I don't like these children of the day when it comes to all these video games and stuff because that's making them children too sedentary. And now I see why you have all these obese children. Just saying.
Well, it's definitely good to have children at their young age to have other to be around their peers, and so they can they're gonna habitate and learn things from each other. That's how we as species we get. That's how the ecosystem is. You learn from you learn from your environment. But if you got a sedentary environment, you know, and
Amen.
you know, what you ingesting is not really reality. Whether you watching sitcoms, TV all day, or you playing a video game, you in a dream world all day. Your reality is not gonna be, a normal
Speaking of this,
reality.
this is gonna be my last comment. Speaking of your dream world. So anyway, as everybody knows, you had a couple movies come out, Leave the World Behind. You had The Color Purple starring Fantasia, who coincidentally gonna be performing at the college football national championship in a week and a half from now. So as Shaq like to say, jumping for Cracker Jacks and get your prize. It is what it is. Yep, that's right. Just want to put them on meds and dope them up. That was Victor texting me. He said just want to put them on meds, dope them up. But yeah. But like you said, jumping for Cracker Jacks and perform national anthem and all this other nonsense that she's trying to do. Playing The Color Purple. Like I said, I met Fantasia one time. She's, I right beside her in Charlotte at the Ritz-Carlton. She was at a ballroom dance, but she wasn't that popular. I said, dang, she more popular now than she was then. Crazy. But that's how it goes, baby. When they want to, they say when you wish upon a star, it makes no difference who you are. And they make you a star if they want to. So that's how it goes. She's from High Point, North Carolina, probably about 4 hours from me, maybe less actually. But nevertheless, just remake Color Purple. They got Leave the World Behind, all of them nonsense. This predictive programming nonsense drill they're trying to do. But nevertheless, that's it. I mean, shout out to information, brother.
Yeah, man. I invited some people in the chat. I don't know if they jumped in the chat. Have you seen any new names? Have you seen any new names in the chat?
Man, look here, man. I ain't gonna tell you a lie, man. I ain't see a thing in the chat till almost 25 minutes into the show, man. I thought they had disabled the chat or something.
A word?
Yeah, man.
Well,
The
they
first
hadn't
person
been
I saw
acting
was
up. They must have been acting up. Let me see. But okay. No, yeah. Y'all can check me, man, on Instagram. Shaq_Edwards on Instagram. Shaq Edwards on
man.
Facebook.
Hold on. Just repeat that. Look, I ain't mean to cut you off, but look, the first message I got in this chat was at 9:30 by Dawson. I started this thing at 9 o'clock, dude. Whatever. So I just letting you know. So it is what it is. I don't know. I told you they was trying to disable some updated features or something like that. I do not know. And guess what? And I did find out from Wes, they did hack they hacked Blog Talk or something like that. So that's why, man, a lot of crazy stuff going on here. Communications, crazy stuff, man.
You said they hacked Blog Talk?
Yeah.
Damn.
Yeah, it is what it is. But go ahead and repeat your information. My bad for bringing it up.
Yeah, man. Y'all can check me on Instagram, Shaq_Edwards, Facebook, Shaq Edwards, or I see Frank down there. What up, Frank? Yeah, and yes, with it. Facebook, Shaq Edwards, CHAQ Edwards, and Instagram the same, Shaq_Edwards. YouTube, like I said, it's under construction.
Well,
I've been saying it for the last 2 years. I've been saying I'm gonna get an X too, because
don't worry about
I
it.
see
Don't
people
worry
be
about
doing
it.
the
They
Twitter
don't, hey,
spaces,
look,
man.
man, don't worry
We need
about
to
it.
get on Twitter
YouTube under
space too.
construction. YouTube under construction. Our mind's under construction right now. Don't worry about it. Trust
me. Yeah.
We trying to construct our way through this bull crap, man.
Man.
But nevertheless, it's all good, man. Like I said, it is what it is. But like I said, I'm gonna come on next couple days or so. We're gonna do a part 2 because I got a lot more stuff I got to break down on this, man. Oh man, this thing gonna be like daggone blow pop in 20. Man, you gonna start seeing some fireworks pop off in 2024. 2023 was just an election year too, man. They about to start doing some wild stuff on your tail, boy.
Yeah, they already ramping up the police brutality stuff and
I know it.
They already ramping it up. Now it always goes. See, this is the trick. It always happens. It's always going on, but they pick and choose when they want to exploit it and use it for their, political,
Hey, you got to bring it up. Hey, look, man, you ever heard what the old saying? You got to go in your duffel bag and bring it out when you're ready to use it.
Hey, yeah, you got to talk about that, the ATF, man. You got to talk about this with the immigrants, man. They claim being allowed to get. Yeah, we want to bring that up.
They getting firearms. I know. Well, actually, they got a caravan. They tell me coming across the border right now. So, yeah, but that's I actually sent you an article in the group text the other day about it. They able to get the firearms, something like that. Yeah. I mean, hey man. But you better watch the ATF because they'll come banging on your door. Matter of fact, they kick your damn door in. As a matter of fact, the ATF one time rolled up on me one time, daggone up in these apartments up the street, down the street now. But when I was coming up, probably about I was 18, 19 years old, me and my buddy was riding, and he lived in one of these apartment complexes. Now they kind of gave it. They used to call them Logan Village, but now it's called the Belt Atlantic or something. It's still crazy as hell over there though. But that jump been there for a long time, right across the street from George Webb High School in Richmond, Virginia, man. And I mean, like the ATF used to come over there sometime, and they pulled up because I rode the car in there. They were like, ain't no trespassing there. They checked the car and everything, shit like that. I said, no guns in here, man. My boy, he's on his side, boy, throwing up. The daggone little did they know, but here go the thing though. See, they didn't see nothing in the car. Little they know, my boy had a shotgun in the trunk. But we got away that day. But just saying, man. But yes, the ATF, they used to be in this apartment complex heavy. Yes.
Yeah, I just seen them roll out. Man,
you remember Dipset? The group called Dipset?
Yeah.
One of the guys from Dipset used to be around there. I think his name was like Hell Rail or something like that. His name Hell Rail or something like that.
Oh, Hell Rail.
You heard him, right?
Mm-hmm.
Yeah, he was over there. Matter of fact, they brought out the other boy that ain't one time, but Joel Santana or something like that. So yeah, it was interesting. Those were some interesting times, man. That about 17 years ago, but I remember those times. But
Yeah. Well,
but what I'm saying is, I had a personal experience with ATF. They will roll up on your butt. I'm gonna tell you that right now. I know what they do. So, but That was my bad because I shouldn't have went in the gates. But if I would drop them off at home, but they were out there that night and they were just randomly just rolling up on people. So, but you live and you learn, brother. But
all right then, man. You know, shit, it was
take your time, man.
always a pleasure.
No, ain't no big deal, man. Take your time, man. We gotta do this again. Frank Nitty, miss you on next one. We get you on next. Miss you on this one. We get you on next one. Bishop Scott, same thing. I don't know what's going on.
Yeah, chop it up with me, Frank, man. Let me know next time you go live, man. I've been thinking about firing my stuff up for the first time, my StreamYard on my YouTube. So I'm gonna see what's up.
All right, take your time, brother.
All right, salute.
Yes, sir.